And here in Module 6, we're going to talk about developing an OCD management plan, understanding OCD, seeking professional guidance, implementing evidence-based treatments, medication management, develops coping strategies, establish healthy habits, create a supportive network, monitor the progress of and adjustments, practice self-compassion, important, stay committed to recovery. Okay, so without further ado, let's crack on. So, basically here we have developing an effective OCD management plan is crucial for individuals seeking to alleviate symptoms and improve the quality of their life. Here's a comprehensive guide to crafting a personalized OCD management plan. Now, that's something we'll get into a bit later. Understanding OCD, start by educating yourself about obsessive compulsive disorders, including its symptoms, causes, and common triggers. Understand the nature of the OCD will empower you to better manage its effects on your daily life. It's imperative that you seek professional guidance, consult with qualified mental health professionals such as a therapist, a psychiatrist who specializes in treatment of OCD. They can conduct a thorough assessment of your symptoms and develop a tailored treatment plan based upon your individual needs. Now, implementing evidence-based treatments is a very interesting concept. The cornerstone of OCD management is a cognitive behavioral therapy, as mentioned before, CBT, particularly exposure and response therapy. And then you have ERP, the exposure response prevention. Involves gradually, as we mentioned before, but we'll go over again, involves gradually exposing yourself to the fear of situations or triggers, or refraining from engaging in compulsive behaviors. Your therapist will guide you with this through the process and help you to develop coping strategies to manage anxiety. Now, medication management. In some cases, aforementioned, medications may be prescribed to alleviate symptoms of OCD, particularly when combined with therapy. Selective serotonin or reuptake inhibitors, or SSRIs, are commonly prescribed antidepressants that can help reduce obsessive thoughts and compulsive behaviors. In some severe cases, this can be taken. However, to be taken in a very responsible manner, and definitely consult your doctor about side effects and ask many questions. Developing coping strategies. Basically, here, identify the practice coping strategies to manage the stress, anxiety, and OCD symptoms in your daily life. This may include relaxation techniques, mindfulness, meditation, deep breathing exercises, and engaging in enjoyable activities to provide distraction and relief. Now, we're going to be covering some of this before, but we're going to go over it because we need to be thorough. Okay? So, establishing healthy habits is basically so important because you have to prioritize yourself and activities such as regular exercise, healthy eating, adequate sleep, stress management, and overall well-being. Maintaining a balanced lifestyle. It's all about balance, you see. Can reduce OCD symptoms and improve resilience to stress. All of these individually are powerful. Combined, they are like an atom bomb for combating OCD. Now, creating a supportive network, surround yourself with supportive friends, family members, and support groups is very key to understand and validate experiences of OCD. Share your challenges and successes with others can provide emotional support and encouragement on a journey to recovery. You must monitor the progress and adjustments, regularly track the progress of managing OCD symptoms, and evaluate the effectiveness of treatment strategies. Be open to adjusting your treatment plan based on feedback from your therapist and changes in your symptoms, or circumstances. So basically, you have to know your numbers. You have to keep track. You don't have to be obsessive about it, but just keep track. Just be mindful. Start somewhere. If you're overwhelmed by all of this, just start somewhere. Start with small steps. Do what is comfortable for you. Try and push yourself out of your comfort zone now, because that's when great things happen. But don't take on too many things. Just make yourself a bit uncomfortable every single day and do small steps. You will see great changes happen. Another thing is self-compassion. Something that many people don't have or lack. Be kind and patient with yourself. Be your own best friend. Be your own best partner. In essence, love yourself in a compassionate manner without the ego. Be kind and patient with yourself as you navigate the ups and downs of managing OCD. It's not a race. It's a journey. It's a process. Recognize that recovery is a journey. The setbacks are, in essence, a natural part of the process. But don't think black and white. Stop thinking in black and white terms. If you fall, you don't give up. You make one slip up, one rumination, one OCD trigger. You check something. You can stop straight away. You don't have to feed into it as it tries to get you to feed into it more. Just stop. And then go back to where you were, the progress. Every second you can go back to progress. Instantly. And celebrate your progress as well. Your achievements along the way. Celebrate them. Pat yourself on the back. Say well done. Today's been a better day. And tomorrow will be another better day. Improve. And if you relapse, if for whatever reason it goes really bad, get back on that horse. Keep going. Stay committed to the recovery. It's going to be potentially a lifelong journey. There'll be moments where the OCD will subside, it will go away, and you will feel like you're recovered and think, oh, I don't have OCD anymore. It's happened. I've seen it happen many times. And it's very quick. However, it can always come back through stress, circumstances. Just keep practicing the principles of mindfulness. Keep practicing the principles that got you to improve, and do them every day. And always be mindful of this and keep moving forward. Never stop maintaining your mental state. You have to keep maintaining and looking after your health. Much like you have to work out, maintain your body and your health. You have to maintain your mental health as well. Just remember, the recovery does take time. And your effort, your decision, dedication and perseverance, you can regain control of your life and experience greater well-being and happiness. That's the amazing thing what I found is when I gave up coffee, my natural levels of happiness became more profound over time. They increased. This is very interesting. I'll do an entire course on coffee and giving up coffee because it's very, very profound. I'm going to do many courses about many things, but that's one of my top of my list as well. By following these steps and working closely, let's say, now we're going to talk about the next step, working with a qualified mental health professional, therapist, you can develop a personalized OCD management plan that addresses the unique needs to empower you to lead with fulfillment in your life from the constraints of OCD. Remember, the help is available and you don't have to face OCD alone. I've seen many people face their own mental challenges alone. You don't have to do it. You shouldn't have to do it. You don't have to do it. Start today. Start practicing what I'm teaching. Start looking within. You can do this.